I think we are most likely there.
Probably. Usually shows up a few seconds later on
Yeah,
our
it
face.
does.
There we go. All right, we're definitely live. Okay, welcome back, everyone. I'm being Caroline again for today, as she's still in the out in the islands. And we have Vicky with us again today to help answer your questions. And yeah, we got quite a few questions, and I just heard Lise say something very interesting. Movie that is movies come out. I think maybe we could start with mentioning that one.
Sorry, you just believed the film. Is that, am I allowed to talk about the
Yes,
film? Yes, yes,
yes,
yes, yes.
new movie.
Definitely the most memorable thing that has happened to me in the last week is that I finally got to watch the film. It's called Introducing Homeopathy, and it's a proper length. I think it's slightly more than 2 hours long. If you watch it in normal speed. Um, um, and it's beautiful. It's just a really nice, well, it's introducing homeopathy. I would just really ask everyone to watch it, and everyone to ask everyone they know to watch it. It's been out for a little while, and I've only seen clips of it before. There's lots of teachers and colleagues and friends who take part in it, but I've never seen it in its entirety before, and I was just so moved from it, really. The I mean, it just shows what homeopathy can do. And then it puts into words something that I've been thinking about this since I watched it, and I wonder whether it resonates with you too. I mean, Vicky, you haven't seen it yet, I know, but what it made me think about was something that I have lived with for 30 years, but not put into words before, which is this odd, not conflict. I'm not sure what the word is, but there's something grating about working with homeopathy and knowing what homeopathy can do and seeing what homeopathy can do every single day. And at the same time, the rest of the world doesn't seem to know. And it's almost like, I think most of the, I don't know, friends and colleagues and most of the people that know me and know what I do, but don't know homeopathy, I imagine that they think it's some cute little nice, sweet side cozy natural thing, but they don't realize. And it's that sort of contrast that I mean, every single day I see, absolutely, I can only say miracles, even though that's, it's just things that aren't supposed to be possible happen on a daily basis. Cancers cured, dogs that have been sick for years cured. I had a dog recently that couldn't walk with arthritic pain. The pain couldn't be alleviated through any kind of conventional medication. The x-rays were awful. The dog was about to be euthanized. When you get the right homeopathic remedy, the dog runs around like a puppy, no pain. And you don't understand how it's possible. And it's almost like you can't quite talk about it, because either you're going to stand like a mad person on a street corner, wearing a billboard, or you just kind of quietly go about your business and don't share what you see every day. And I think it's been bugging me for years, but I haven't really put it into words. But that film kind of addresses that, how homeopathy is absolutely scientific, rational, cutting edge, incredibly powerful, probably the most potent system of medicine there is. And yet most of the world just sort of disregards it. And it's bizarre. But anyway, it's just really set me thinking about how it's odd that homeopathy isn't, that everyone isn't seeing a homeopath. It's bizarre when you know what it can do. I mean, I don't know, Vicky, do you recognize that sort of odd, I don't know what the word is.
Yeah, I mean, absolutely. I think the wider population have very little understanding of homeopathy and its potential and what you can do with it. I think, even someone who thinks they know about homeopathy, they might just be doing, arnica for
Yeah,
bruising or aconite for shock, or, one of the combination remedies for anticipatory anxiety or something like that. But actually, like, the scope of things that you can treat and the scope of healing that it can provide when you get the right remedy is just, immeasurable, and it is very little understood.
yeah, Exactly, because it's great for those things. It's great for acute disease, and it's great for for this and that and home treatment. But when you see an expert homeopath as a person, and they give you exactly the remedy that suits you, your life has changed on all fronts completely forever. And it's hard to put into words what homeopathy can do. So just to not appear crazy, I think most of us just kind of do the work and I don't know. It's just I haven't thought of it quite. I haven't quite thought about that aspect of it before, but once that film made me think about it, it's just become really clear to me how that sort of, I don't know, weighed on me in some way, or not being able to quite communicate, or people not quite understanding what you're doing. It's like it's a natural little sort of,
I wish there was more people out there who were filming these miracle workers, like yourself. I don't know if you guys seen the Doggy Doc, for example. There's also where they follow a bit in a like a more integrative clinic, and they've given the lives back to so many patients, and then there's so many who's completely oblivious to what's going on, or don't believe, or don't, I don't know. It's it's a shame. I think I was crying my way half through that movie before, like 5 minutes in, and I already cried twice.
Yeah.
I was just like, this is beautiful. Why don't
but
they
it is so beautiful. It's hard to put into words. And I think homeopathy and acupuncture are the two sort of really deep acting holistic modalities, certainly that I know of, that can treat someone on such a fundamental level that everything is just different, and your health is different, and your perspective is different, and everything just falls into place. It's
the name of the movie again, and where they can find it?
Yes, it's called Introducing Homeopathy, and it's I don't totally understand how it's being distributed, to be honest, but I've not been able to find it and watch it in its entirety before. But at the moment, there's a charity that is sponsoring, trying to get it out everywhere so that everybody can watch it for free for a limited period of time. Well, let's put the link on the Holistic Vet Sisters webpage after tonight. It's only for a few days. It's available throughout this weekend, and then it's either unavailable or you have to pay for it. I'm not entirely sure, but everybody can watch it for free for the next 3 or 4 days. And I would just absolutely, I mean, just please watch this film, and please share the link, and please get everybody to watch it. It's amazing. It's really, really beautiful. I love it.
Should we continue with some more homeopathy questions
Yeah.
when we're on the topic? Because Michelle had a question about, well, I guess mostly homeopathy, so Lise. She's asking, why would you prescribe opium for a dog with I can never pronounce it,
regurgitation, presumably, yeah.
He's under Dr. Brandon's care, and also Hypericum, but would like to understand the reasoning behind the option if possible. Obvious, vet says all the details of him, and I trust his recommendation, but just curious for myself, why that particular medication?
Okay, I mean, if I'm to start, I would say, obviously, for your particular dog, to understand why this was prescribed, you'll need to talk to Brendan. But in more general terms, what a homeopath always does is try to match try to see a pattern, or a sort of a picture that makes sense in the symptomology of a patient, in the widest sense of that word. So you try to understand everything you can about the patient and see a bigger picture, and then match that with a homeopathic remedy. Some homeopaths don't want to tell what they're giving. It's not unusual for, I call them human homeopaths. They obviously just call themselves homeopaths, but homeopath treating people rather than treating animal. It's not unusual for them not to want to say what the remedy is. In fact, I've been treated and just even said, don't tell me, because people will typically go home and look it up and say, well, that doesn't fit, and that doesn't fit, and that doesn't fit. And it's important to remember that everything that's deemed important in the patient has to fit the remedy. but not everything in the remedy has to fit the patient, which is why it's hard to say why your dog was given opium.
And I mean, I also think there's so many different ways of coming to a remedy, and you could, you know, 5 different homeopaths could see the same patient and give 5 different remedies, and they could all work to a degree and help with some of the symptoms, but potentially only one or none of them will be the perfect remedy that resolves everything. And it's, you know, sometimes you prescribe based on, you know, a really strong causative reason for what's happened. So in this case, you know, maybe it's a condition that had come on only after surgery where they'd used a lot of pain relief. So then maybe, you know, opium would be part of that picture. Or, you know, maybe it's, you know, after a big grief, like they lost another animal in the house and then this condition developed. So you would choose a remedy that's big in the picture from grief. Or it could all just be, you know, if it's a low potency remedy, it could all just be based around the actual symptoms themselves and what makes them better or worse, and that kind of, you know, low potency prescribing where it can be a little bit more textbook. So, you know, certain conditions you use certain remedies. And then obviously there's what we do as more of our bread and butter as, you know, professional homeopaths, which is doing the more constitutional type prescribing, where you're taking the entire case, like Lisa's explained, and you're trying to create this picture of the patient, including all of their symptoms, their personality, their character, their likes, their dislikes, all of this, and then trying to match that with another homeopathic remedy. And hopefully that will be the correct match. So there's just so many different ways that you would have to ask your homeopath specifically why they chose that remedy.
Yeah, I think it's a good answer. I have the same issue sometimes when people ask for, hi, do you have a Chinese medicine for this? And it's like, whoa, that's not really how it works, you know? And sometimes also I've had this recently as well. Someone asked me, what do you think it could be? And I was like, well, in Chinese medicine, you know, this aggression can be linked to the liver. And then they start giving, you know, milk thistle and stuff. And it's not really, it's easy to misunderstand, I think, when you know, when you're into this. So the best thing really is to go see a practitioner who does this professionally, get their advice and follow their advice, because trying to do like halfway conversations online and stuff, it doesn't always reach the goal, if you know what I mean. So I think
it also just shows how little a lot of the population understand about holistic medicine and how it works. Because I get those emails all the time as well, like, oh, my animal has X, Y, or Z. Can you recommend anything? And it's like, well, firstly, it would be super inappropriate for me to just recommend based on you just telling me what condition your animal has. Because, you know, do they have another condition? What symptoms do they have? Like, there's so many other things you need to know. It's not just like, oh, Cushing's disease, you give these things. But that's how we treat with conventional medicine. You know, there's a set number of drugs that you use for one condition. So there's usually, like, you know, for the first time you encounter it, you give this drug, and if it doesn't work, maybe you try this drug. So that's what people are used to. So I think it's really important to help educate people on how holistic medicine works. Not just, you know, the fact that you have to have a proper case taking and you have to understand the patient and everything about them. So as an owner, you have to be willing and able to provide that information to have the best chance of having success treating it. But also you need to have different expectations, because, you know, you put an animal on steroids, you're going to see a reaction within days, sometimes even, you know, hours. But with holistic medicine, I mean, sometimes with homeopathy, you get those cases that just respond immediately and it's amazing. But other times it's like a much more slower process. It's working with the speed of the body. You can't make the body go on fast forward and fix itself quicker than it's like physiologically able to. So it's just that totally different style of medicine and way of working.
Yeah, that's such a good point. And in a way, I mean, it would be inappropriate and it would be illegal for a conventional vet to prescribe based on an email that says, this is my animal's diagnosis, what can I give? But it would be much more, I mean, it would be possible, because in conventional medicine, you treat based on a diagnosis. So if the diagnosis is correct, you pretty much know what your treatment options are anyway. Whereas in holistic medicine, it's completely impossible, because it's about the individual patient and not certainly not entirely about the diagnosis. So you can't treat without knowing the patient, and that's why it's so time consuming, and why you need to, you know, know what you're doing, because you need to find out what individual treatment that individual patient will respond to.
Exactly. And going forward, I think, Lise, you said you also had more questions about homeopathy.
Yes, there was Jane asked, could you explain the difference, if any, between nosodes and tautodes, and when it is advisable to use them, please? Is there any evidence that regular use will help to protect unvaccinated dogs against diseases like lepto or kennel cough? I mean, the definition, first of all, tautodes, T-A-U-T-O-D-E-S, tautodes. These are just words, but I mean, this is what homeopaths call a homeopathic remedy that has been prepared from a medicine. So it could be a vaccine, which is, I'm sure, what Jane is talking about here. So homeopathic remedies made from vaccines, as opposed to nosodes that are homeopathic remedies made from disease matter. So you could have a kennel cough nosode or a kennel cough tautode, and one would be made from kennel cough secretions, presumably, and the other would be made from the kennel cough vaccine. And sometimes they are used interchangeably when we use them to try to protect against disease. But if you want to do it, textbook, you would use the tautode if you were treating ill effects from a vaccine. Then you can use the remedy made from that vaccine to try to counteract ill effect that vaccine has had in an animal. Whereas if you use the nosode, you would give it to protect against the disease. Do you want to add anything, Vicky?
I mean, I think that pretty much just summarizes it. They're very different. You use them in very different ways. But yeah, I think maybe people don't always understand the difference between those. So
and it's also not, it's also, sometimes you have to do a little bit of detective work from the pharmacies to try and find out, well, what is the origin of this remedy? You know, what's it made from? Where does it come from? And if it's made from a vaccine, is it a vaccine that's still in use, or is it some you know, which is my main reason for not using tautodes very much at all, because I think if you use it, it has to be quite specific. I don't use them much.
I totally agree. I don't use very many tautodes because of that same issue. You know, sometimes you don't always know the exact, you know, vaccine brand, or you know, the exact combination that they were given, or there isn't a tautode that has that exact combination. And then I also always think, you know, they always say, you know, they've changed the recipe of or the ingredient of some of the vaccines over time to make them, I don't know, more effective or less problematic. And you know, is it a modern one that they've made it from, or a previous one?
But I also think more fundamentally that I think they have a role to play. I think particularly they have a role to play if there's an epidemic of some kind. You know, if you've been to puppy class and you're told the next day that there was kennel cough there and they're falling ill, then I would absolutely give the kennel cough vaccine. But 20 years ago, it was more common before we had more insight into how to vaccinate minimally. Homeopaths, thinking of George MacLeod, particularly one of the elders among veterinary homeopaths, recommended a sort of regime where you would repeat nosodes continually through the animal's life instead of vaccinating. And I think that probably had a role to play 20 years ago. But today, I find it much more useful to be very, very careful about how you vaccinate. And you can actually protect an animal through, I mean, if you do it right, through one shot in its life, which means that they are protected. So I can't really see that nosodes have a huge role to play in general. I mean, I don't think all dogs should be on nosodes at all, is what I'm saying. I think all dogs should be vaccinated. But go on.
Lepto is the one where a lot of people who don't want to vaccinate at all, or because it's such a short-lived vaccine, or we can't measure the effects. I think that's the one where the nosodes are much more useful.
How would you use them for lepto? What do you recommend?
So I do a regime a bit like George did, where I have it as they're given continuously. Just because of how they're theorized to work, you know, the energy of the remedy has to be active within the animal in order to prevent disease. So you need to make sure you're giving it regularly enough. So I have you know, give it daily. daily for 5 days, weekly for 4 weeks, and then monthly. And if they hear of an outbreak in their area or something, then maybe to restart it.
And there were actually some questions. Kelly and Lynn are asking about the risk of leptospirosis in the UK. I think it's Kelly saying we're on a small holding. It's hard to get rid of rats. How worried should we be, and what should we do? That's one option, is what Vicky is saying. I don't see enough lepto to find it worth. I mean, I don't see any lepto, to be honest. So I don't worry at all about not vaccinating against lepto. But if you are in an area where you know that there is lepto, active infections happening, then that's certainly an option. I don't see that, I must say.
I mean, I've not seen any confirmed lepto cases in my career, but I know there is a lot of scaremongering in the UK about lepto. And, even just the other day, a client said, my practice just posted about a couple of cases on their Facebook page. And I went and looked at the Facebook page and it said suspected cases of lepto. So again, there's like all these cases where, I've seen liver and kidney failure, obviously. Who hasn't, as a vet, seen liver and kidney failure? But I'm not going to automatically assume that it's lepto without doing any kind of testing, because that would just be really inappropriate. And so I think those kind of cases are often used as ways to encourage people to vaccinate. But that's where I like the Nosodes use for lepto. Firstly, because it's, there's studies that show that that's effective in an outbreak, and because the lepto vaccine is not a good option to use minimally.
No, absolutely. No. Minimal vaccination, we're talking about the core diseases, parvovirus, distemper, and hepatitis.
I actually heard in the US now they're starting to make lepto part of the core vaccines as well.
Well, yes, and the wording in the recent version of the WSAVA guidelines, I haven't got it in front of me now, but it's very woolly. They're not, most vets quote it as, in the UK as well, now lepto is a core vaccine, but it's actually not what they say. They say it's a core vaccine where the serotypes are known and represented in the vaccine. And that information is really hard to come by. What serotypes are making dogs ill? Where has the diagnosis been verified? And we know the serotype. And it's one of the few that's present in the vaccine. But they have that little add-on. They think it should be a core vaccine in areas where leptospirosis is happening, and it's those serotypes that are in the vaccine.
But I mean, who is testing the environment and seeing which serotypes it is?
Yeah.
And there's lots of cases of dogs that have been confirmed to have lepto where they've been completely vaccinated with the 4 serotype 1 their whole lives, and they've still got lepto. So that's another reason why I'm just really discouraged of ever recommending a lepto vaccine.
I've worked in the UK as well, and obviously I haven't worked just as long, but I still haven't seen anything in my year there either. Haven't heard of any who's seen a case. Obviously it's a lot of, I think, like you say, a lot of fear mongering, a lot of, they say it's this, they think it's this, but they haven't tested it, they're not sure. And also I think because the vaccine is not 100%.
The vaccine it's a really poor vaccine in terms of providing protection. Yeah, no, absolutely. So I mean, that's kind of the answer, isn't it? There's 3 of us here. We've all worked in the UK. None of us have ever seen, is that right? I'm not the only one. None of us have ever seen the confirmed case of lepto ever. And we must have a combined, I mean, I may have been in practice more than either of you, but between the 3 of us, we've got quite a few years of small animal practice, and none of us have ever seen a case of lepto. That's how concerned you have to be about lepto if you're in the UK. I mean, come on. I mean, a vaccine is supposed to be an answer to a problem, isn't it? It's supposed to have a problem, and then comes the vaccine and solves the problem. Like it has for several human diseases, like I think it has for hepatitis in dogs, distemper in dogs, parvo in dogs. It solves a problem. Lepto, there's a lot of talk of a vaccine for a disease that none of us have ever seen.
And hepatitis, distemper, I've never seen those, whereas parvo, I've seen multiple cases of parvo in various different settings around the country. So that's the one that if I'm talking to people about vaccines, that's the one that I would be recommending, or that I would be most concerned about them getting the disease if they weren't vaccinated.
Yeah, no, totally. And if you're doing titer testing, and that's the one I'm looking at, you know, that's the one you want them to be covered against. I mean, I'm old enough that I have seen distemper, but parvo is the one that's around, and parvo is the one that you want your dog to be protected against. Absolutely.
Mhm.
Yeah. But I think it's probably fair to say that the other two have pretty much gone because of vaccination. Whereas it's I think the only point I was trying to make is that surely the way vaccines should be used is that we have a problem and then we get a vaccine to solve that problem, not that we have a vaccine to sell and then we invent a worry in the population.
And also, what I find bizarre is that obviously people can get lepto, but there's
Yes.
no lepto vaccine for people. And you think that, you know, for example, everyone who was working on, say, a dairy farm, where you're going to constantly have splatters of urine and feces land on you, because if you don't know about this, that's what happens when you're in a milking parlor. And, you know, like not all dairy farmer workers are having a lepto vaccine. And, you know, cows can get lepto. They're not all, you know, dying of lepto. And supposedly these are a lot of the contamination places through rats that they're getting it. And we're not seeing that. I had a client actually who they have a slow farming beef company. And they were asking me about lepto. And I said, you know, have any of your workers ever got lepto? Have any of the other animals on the farm ever been diagnosed with lepto? Then you probably don't have lepto on your farm. You probably don't need to be hugely worried about it, because if it was a massive issue, somebody else on the farm, whole farm system, would have become ill by this point.
Yes, it would have been a problem that needed solving. But it's hard to find the problem, isn't it? It's hard to find the problem while we're all talking about lepto. And not only can humans also get lepto, it's much more common in humans than it is in animals. The last study I saw said that 10 times more people than dogs get lepto. So it's a far bigger problem in humans than it is in dogs.
Times more people.
Yeah, yeah, yeah.
I mean, I'm
Particularly
amazed they
people
haven't tried to roll
working
out a
in
vaccine.
fish farming and people working in sewers and that sort of. I mean, they are. And yet, and I think that I'm actually not totally sure about this. If anyone can find the information, I'd be very keen to see it. And I have looked for it. But as far as I understand it, there has been a vaccine developed for people, or at least they have tried to develop a vaccine, but it's not being used because it's not good enough or not safe enough. But efforts have been made, but it's far more common in people. And the one point that's always being mentioned about lepto is that it's a zoonosis, so that if your dog gets it, it can infect you. And I have searched really hard and I've not been able to find a single case ever where that's been documented to happen. So it just seems like a slightly made up problem. I'm not saying if someone out there knows a person or a dog who's had lepto and been really ill, you know, it is a serious disease, and it's obviously exists. It's not a made up disease, but it's just not the common problem that it's sometimes made up to be when we talk about it. So anyway, the three of us have never seen it through years of practice. So I sort of think that says a little bit about how worried we should be about lepto.
I agree. Should we carry on with some more questions? We had a bit of a bigger topic here from Claire, because she's asking, please, a question for you on the best way to help raw fed, mainly organic meaty bones, no chicken, yeasty dogs. I need to understand more about what I need to do and to help one of our dogs. Already using homeopathy, but need more tools, I think. Who wants to start this big topic?
I mean, I'm happy to start this one. So my first question in a case like this would always be, you're using homeopathy. Are you using it yourself at home, or are you using it under the guidance of a vet homeopath? Because it's very unusual for a chronic skin complaint to respond well to an acute skin remedy. You're not going to cure your case by giving just one of those remedies. Skin cases are really complex. They can take a lot of time to resolve, even under a good homeopathic vet. Sweetie, I know you want some water, but Papa's just over there and he can get you some water. And yeah, people often have to dedicate a lot of time and effort And I'll carry on talking about this in a minute when I've thought about this.
That's all right. No, but it's very true. I'm assuming when you say yeasty dogs, it's like Vicky's saying, it's a dog with a tendency to skin complaints and yeasty overgrowth, which typically happens in dogs with allergies. And you're not going to cure, if that's what it is, if you have a dog with a tendency to allergies, you're not going to be able to cure it at home. It's very unlikely. In conventional veterinary speak, that would be incurable. And there's, you'd have to go on immunosuppressive medications to control an allergic dog. We know that with holistic therapies, it is often, not always, but often possible to find a cure for these dogs, but it does take time and it does take expertise. And it's unlikely for diet to be the full solution. I've seen a couple of patients that were where the problem was a food allergy or a storage mite allergy to such a high degree that changing the diet cured them. But I sort of find it's become, I don't know how to say this quite, because obviously diet is important, and obviously a healthy diet is important, and it supports good health, but it's become such a hot topic these days that I find that people come quite often with chronically ill animal and a feeling that they've tried everything, and all they've really tried is to change the diet. And even though diet is important, changing the diet is not going to cure most chronically ill individuals. You need something else as well as a healthy diet and a good diet. So I would certainly say to Claire, if you have a dog with an allergy, see a professional, see a veterinary acupuncturist or a veterinary homeopath. And there's a good chance that you can cure your dog. But I wouldn't expect to be able to solve that at home. It may not be what you're doing, but...
I love to talk about yeast. I love the allergy cases and yeast. So yeast and allergies very often go hand in hand, usually because yeast is an imbalance in the microflora, which usually comes together with leaky gut and allergies. So they usually come together. I've treated a lot of yeast, and I think I might be biased because in my practice I've treated a lot with raw food, and very often it goes away, especially if it's mostly a yeasty issue. It goes away just by changing to a low carb diet. I think the thing that I found the most with yeast is that both in people, candida, and in dogs with yeast problems, all fungi need sugar to grow. So stress and a lot of carbohydrates in the food is what I find is like two major, it's like a major point for yeast to grow into its pathogenic form. Especially, you can also add like oatmeal shampoos, which is actually, oatmeal is a sugar, which I don't generally recommend for yeasty dogs. So yeah, I typically, when I have a yeasty problem, like to put them on a raw food with very low to no carbohydrates, because usually the yeast struggle to grow with that without any carbohydrates. But again, can still happen. But I think I would put a big focus on the gut microbiome. You can fecal test, you can test the microbiome of the dog to see what their bacterial levels are in their gut, and it could get recommendations on what to feed on top of that. For allergies, if they do have underlying allergies to specific proteins, I do know chicken is a common one, but maybe because there is chicken in all dog food in every way almost. So I think that's very represented because it's in all dog food. I have actually made a resource for pet owners as well for how to do an elimination diet. I've posted it. I think I posted it already. It will anyway be my social media is Purple Vet. You can go on and go to the link in my bio, and I will have a resource for pet owners on how to do an elimination diet and how to get on with that. Another thing I would add that I do like in some cases like this is quercetin, which is nature's Benadryl, can stop the release of histamine, which I use sometimes in practice. Vicky, do you have any thoughts on yeast?
I mean, do you find the quercetin actually helpful? Because I've had lots of clients use it in skin complaints, and I've never really seen it be particularly effective. So I'm interested if that's something that you find seems to actually work.
I have, but I'm not sure if it was the quercetin itself or the change of diet.
Yeah.
So
I mean, it's one of the first things I do in a lot of skin cases is try with diet, because especially with allergic skin disease, you can't control grass, you can't control dust mites. Like there's so many of the allergens that you have zero control over, whereas food you've got 100% control over in a dog, or in a scavenging dog maybe 90% control. So, if food does help, even just a little bit, then that can help you to step towards them being much better while you're then working with the body with your homeopathy or herbs or whatever else you're doing. So it's always worth trying with food, but it's unusual unless it's a really young dog. I find if their skin complaint starts when they're, less than a year old, or particularly less than 6 months old, then quite often it is food related. And if you get the diet right, then I find that seems to sort things out. But a lot of the chronic allergy cases, you can do whatever you want with the diet, and you are not going to resolve that skin complaint unless you're doing something else. And I find
Amen. Can I just, yes. Because it's a very common misconception these days, more in recent years, I think, than I've ever made it before, that, we've tried everything. And what they've really done is change the diet around a bit. And it's never going to be enough for those chronic cases.
Tried some over-the-counter itchy dog supplements, which, also, if they work, lucky you, because for the majority of skin cases, they're not going to work. And I also find skin cases are often the ones, like, I've had some amazing ones where the first thing you try, it just works. But I always say to people at the beginning, like, yes, what we do first may be the first thing, but it may take us months to work it out, because I find more than any other disease with skin cases, a protocol that worked like miraculously for one dog will do nothing for another dog. And similar kind of things, like if you get the right remedy, if you get the right herbal thing, if you get the right diet, sometimes it just works. But the majority of cases you have to experiment, and you really have to dedicate time to them. They can be so difficult to treat. And as a homeopath, I find anyway, like, I'm as frustrated as the owners that it's not responding. Like, I would really like to just be able to fix it. But sometimes you just have to keep trying. And particularly with homeopathy, and with homeopathy in animals, I find that sometimes you kind of have to, especially if you've never used holistic medicine or homeopathy before, sometimes it takes a while to like train the owners to be able to answer the questions to give you the information that you need. Because sometimes when you first see somebody for a consult about their pet, and you say, they're talking about them barking at something, and you might say, oh, well, what are they trying to say to you? Or you might ask, what do they think of themselves? Or how does it make them feel? What makes this symptom better or worse? Is there a time of day? Is there a temperature? Is there a weather? All of these different questions. And if you've never dealt with homeopathy or holistic medicine, a lot of times people go, I don't know. And they might answer, I don't know, to loads of the questions. And then you've not got so much like core information to choose a really good protocol or remedy from, that as you spend time working with them and with that animal, more and more comes out about who the animal is, what their different modalities are, and you get more information because the owner knows what to look for and what they should be monitoring. And then sometimes, like 6 months, 8 months down the line from when you first started seeing this animal, suddenly you've just suddenly got enough information that you can choose the right remedy. And then it just works really well. But it takes you all of that time and however many remedies you tried before that until you get that information that you need.
Yeah, and you have to see it in the context that I mean, if you have a chronically allergic dog who is or would otherwise be on immunosuppressive medications, they would be on Atopica or Apoquel or Cytopoint or steroids, just to be able to not scratch themselves raw, or suffer with chronic ear infections, or lick their paws so they, to the point of bleeding. I mean, these are, in conventional terms, incurable cases. So the fact that we get them right ever at all is achieving the impossible. I mean, it's not supposed to be possible. So it may not be easy, and it may take months or years in some cases, but the fact that we see improvement at all, and the fact that a lot of these dogs get cured. I mean, most of these dogs, in my experience, get cured, but not necessarily easily or quickly. And we're so used to quick fixes, if we just want something. And sometimes there can be a perception, I wonder if you recognize this, sometimes there can be a perception, because it's holistic, that it's supposed to be a little bit magical as well. It's supposed to be kind of wow. I mean,
Totally.
And when you find out that we have to chip away at it and, you know, they're 20% better, that's amazing. Let's see if we can maintain that. And then we build on it. And, you know, it just suddenly doesn't maybe feel quite so magical. But
I always say
is.
to my clients, I wish I had a magic wand and I could just wave it and it would fix your dog. But unfortunately, we all have to put the work in to try and find the protocol that's going to work for this dog. And a lot of owners don't have the finance to, you know, work through over that longer period of time. But I find even cases that, like, they maybe come to you for a few months and they don't come for a bit, and then the next year they come again for a few months. If they keep doing that, you do often end up finding the remedy, because each time they come, something new has come up and you get a greater understanding. So even if you don't have the money or the time or dedication to do it as a big old section continuously, if you can keep going back to the same person, the more information they get, the more likely they are to find a solution.
Yeah. But it is important to understand that it's a process. And getting them free of symptoms and free of drugs at all is impossible. And yet we see it over and over and over and over again. So, you know, it's okay sometimes that it takes time and effort and patience and things go up and down. But we're so used to quick fixes and we want things to be solved.
Well, it's like we were talking about earlier, this sort of lack of understanding of how holistic medicine works because we're so used to conventional medicine. And I think with skin cases, that's just even more exaggerated, particularly if they've already been on the drugs that you described, you know, your immunosuppressants, your Apoquel, and those cases can be, you know, even longer to try and make any progress with. And it's obviously harder to judge your progress because the body's being suppressed, so you're not seeing good reactions like you might do in a dog that's never had those meds. So there's lots of complicating factors in skin cases.
Yeah, I think our summary here is it takes time.
Yeah, and what Vicky said initially, I think it's worth repeating, that it's not, if you have an allergic dog, it's not something you can treat at home. It really isn't. You need to see an experienced veterinary homeopath or acupuncturist, and you need to see them more than once. You know, you need to start a process and work towards curing them, but it's a process, and it needs expert guidance.
And if you're lucky, you might be one of those people that has one consult and we fix your dog.
Yeah.
So
no, that happens too. I had that email today gave a dog a remedy yesterday, and pictures, you know, these are the sores yesterday. We wake up this morning and it's healed. And that's lovely. But I've also had people today saying, but we've been doing this for 3 months. And yes, he's off drugs for the first time in a year and a half, but he's still itching. And, you know, I mean, you get both. Yeah.
We actually got a question in the chat. Maybe I can mention that as well. It's Irma. She's writing about gingivitis in dogs. How can we help the dog? Is 11 years old, been examined and x-rayed, all good. Just gingivitis.
I mean, like, does it still have teeth?
So
like, what's the level with the gingivitis? You know, you get all of these gingivitis where they've just had a dental, but it made no difference. There's still gingivitis. Is it gingivitis with loads of tartar? Because I think the approaches to those would be quite different.
How old was the dog? It was a dog, wasn't it?
Yeah, 11-year-old dog. I kind of assume it doesn't have tartar because it's been at the vet and been examined and x-rayed and all is good. Maybe.
I mean, it's more common in cats than in dogs to have gingivitis as a sort of inflammatory condition without the bacteria and without the teeth, the sort of dental hygiene issues, I would have thought.
They've started to see it more and more in dogs as well, actually. We discussed it earlier at my practice. So, yeah.
We want pictures of that dog's mouth. We want more information, then we can be more helpful. I think generally speaking about gingivitis, a great preventative is raw food, raw bones, you know, using your teeth. But obviously if you're 11 and you've got issues and you maybe don't have very many teeth left, then bones may not be the answer. But I think
all teeth are fine. Teeth are cleaned. Her mouth is sore.
Okay. I mean, one thing that's just really easy to use for gingivitis on like a herbal spectrum without, taking a case or knowing more about it, is I quite like using a green tea and calendula infusion. And I get people to like kind of have a syringe at the back of the mouth and do like a kind of flush over the gums after eating. And that can be really soothing and just help, especially if like they've had a recent dental or something and you're trying to encourage the gingivitis in the mouth to heal. That's something that I found really useful and recommend to a lot of my clients as an extra in gingivitis cases.
Yeah, I've brushed her teeth all her life, but because of the pain, she does not want me to touch. She cannot digest raw bones, but I cook for her.
So painful gingivitis in an older dog where the teeth are fine?
I mean, I'd be wondering if there was some kind of autoimmune thing going on.
Yeah.
That's what I was wondering.
So I'd be thinking that maybe you should go and see a homeopath,
Yeah.
and think about the immune system and what else could be done to support the immune system. And the first thing that always comes to mind for me in autoimmune disease is medicinal mushrooms, because they're just amazing.
And homeopathy. Anything for the immune system.
Obviously.
Homeopathy. Yeah.
Send them all to Lise.
Yeah. And Tina would say, and acupuncture. I'm sure it's just as true for acupuncture, but
yes.
ask a homeopath and that's going to be the answer.
Good
yeah.
Oh yeah. I actually, do we have more questions, or was this something you wanted to talk about as well?
There were more questions. Yes, someone was asking about teeter testing.
Oh,
my vet claims that it only shows the situation at that moment in time and that you therefore can't rely on the results. How long would you say a teeter test can be counted on before you have to retest, is the question. Well, I mean, WSAVA vaccination guidelines say that you should do the test every 3 years. And they say there is absolutely no point in testing more frequently than every 3 years. And they also, not in the guidelines, but the former head of the WSAVA vaccine guideline expert group, Professor Michael Day, at a lecture certainly was explaining that once you have a positive teeter test in a puppy that's more than 4 months old, then you know that the core vaccines have worked for that pup. And then the expectation must be that that dog is protected for life. So the recommendation about retesting, so I mean, the idea that it's just a moment in time and that it may be positive today and negative is in 2 weeks really is nonsense, and shows that you haven't, someone who says that hasn't read the research and hasn't really looked into this, because it doesn't make sense. It's just not how it works. The core vaccines give lifelong protection in almost all cases. The guidelines say in more than 98% of cases, and he was very clear that the recommendation to retest every 3 years is not at all because they expect the test to suddenly be negative. It's only because we have systems in place that are based on the more old-fashioned model of routinely vaccinating every 3 months. So there are lots of groomers and dog trainers and boarding kennels and shows that have got this culture now of wanting to see a vaccination certificate or something to prove that this animal is healthy, and that's sort of a nice culture and something that we should work with. But in his words, a blood test never hurt anybody, and you can't say the same about a vaccine. I mean, this was Professor Michael Day, the world's leading expert in dogs and immune systems and vaccines. And that's why they say do it every 3 years, because if you need to show a certificate anywhere, that with a 3-yearly interval, because that's the license period of the vaccine, then let it be a blood test certificate, a titer test certificate. That's the only reason they recommend doing it every 3 years, not because it drops. And there's been plenty of papers looking at dogs that haven't been vaccinated for, I mean, 10 years and more, to show that the test is consistently positive when we do it, you know, that immunity doesn't fall away. So it's absolutely not correct that it's a moment in time. The recommendation is to do it every 3 years, but that's only because that gives you a certificate to show everywhere where you would normally be required to show a vaccine certificate. It's not because anyone thinks it's gonna suddenly be negative.
But I mean, like, in a way, it does represent a moment in time. And titer levels are going to vary. The antibody levels in the body are going to be varying, you know, but it's not going to be immediate. It's not like your dog's positive one day and negative the next. And vets should understand this because, you know, for some testing, if you're looking for whether it's an active condition, you measure the antibody levels, and then a week or two later you measure the antibody levels again to see if it's an actively rising titer level, which means it's an active infection, rather than if it just stays the same. It means maybe your pet encountered that disease at a previous time and the antibody levels are stable. So antibody levels do vary and fluctuate. But I think if we go back to Lisa's amazing cookie baking analogy that you've mentioned before, like that positive titer test, if you've had it at any point, that shows that they know the recipe for baking the cookies. And if you've got those high antibody levels, then they've been baking all those cookies. But if they've had them before, but they've dropped, it just means they've stopped baking. It doesn't mean that they've lost the recipe and forgotten how to deal with that disease.
Yeah, absolutely. And also, we're not, when we do titer testing, we're not so concerned about the exact level. We just want to know, are there antibodies at all? And I mean, they do tend to be consistently positive. Well, you were saying just before we went live that you just done a whole lot of titer tests, weren't you?
Yeah, so I did a titer clinic recently where I had 30 dogs in one day, and we only had one that failed. And it was an elderly dog that the owners couldn't remember the last time it was vaccinated. And yeah, that was the only one out of 30 dogs, of all varying, you know, some hadn't been vaccinated for, they'd already had like 2 or 3 previous titer tests. Some of them, you know, I had a couple of young dogs where it was their confirming one post initial puppy vaccines. It was like a huge range of different dogs from different places. And yeah, only one of them failed. And I just thought that was great out of 30 dogs.
Exactly.
And I mean, the test has been in use for long enough now that there are plenty of papers published showing that this happens over and over and over again. You know, they come back and they're covered, and 3 years go by and they still haven't had a vaccine and they're still covered, and another 3 years and they're still covered. And it's really important to see that.
And I actually love observing if they're dogs that have come back to me repeatedly, and I've seen that quite a bit over my career as a vet, seeing how the levels change and the score changes to show that the body, you know, particularly with parvo, I noticed this, like maybe you had like a lowish score on a previous test and then you test them again and it's like top score. So, you know, they've obviously encountered parvo at some point and their body's gone, oh, quick, bake some more cookies. And and that's helped them to fight off this parvo that they've encountered. And yeah, I just think the whole thing is just so fascinating.
Yeah.
I love the baking cookies theory.
I'm glad I'm not the only one who thinks this makes sense. This I can understand. Yeah.
But I think something that I've come across a few times this year, and I think this is to do with titer testing becoming available in more conventional vets, is that for some reason, some conventional vets, if they get a positive, but it's not a high positive, they're saying, nope, you have to vaccinate. And the one I saw most recently that a client emailed me was it had been sent off to a lab, and the person in the lab had written at the bottom, all positive titers, you know, so like there was no questioning, there was no borderline results, it just said all positive. And the vet said, oh no, one of them's a bit low, we'll have to vaccinate. And I just said to the owner, like, what is the point in your vet doing this test and getting a positive result from a lab? So it's not just, you know, like someone running it in-house where they could be a bit dubious. They've sent it to a lab. The pathologist at the lab has said, this is a positive result. And they are still saying you have to vaccinate. So if you're doing titer tests with people who are not experienced with running titer tests, you need to make sure you see those results and don't just go on what they're telling you, because I think a lot of vets do not understand titer tests and therefore they're not necessarily giving you the correct advice.
That is a very good point, and I see this over and over and over again as well. And I see this, I also see this idea that a higher score is better than a lower score, you know, and I've even heard vets and vet nurses say that if it's a really high, then it'll be a really long time before they need a vaccine, and if it's a lower, then probably next time. And it's complete nonsense. Professor Day used to say that being protected, if you're a dog, being protected against the core diseases through the core vaccines is like being pregnant. It's a binary state. You're either protected or you're not protected. There aren't degrees of protection.
Yeah.
If it's there, it's fully there. And if it's not there, you need a vaccine. But there is no sort of running a bit, you know, getting a bit low, or it's high. It just shows a lack of understanding for the whole.
But immunology,
Yeah.
because if there's some antibodies there, then your immune system is aware of that disease. It
Yeah.
knows what it's supposed to be doing. If it can produce a few antibodies, it can produce more antibodies if it needs to. But it's not just going to be producing them willy-nilly. Why would the body waste resources producing unnecessary antibodies if you're not encountering that disease? Obviously, they're going to reduce down over time if you're not seeing that, because otherwise our bodies would just be spending endless time on pointless activity. And the immune system's actually incredibly intelligent and amazing, and it just does all of this for us.
Exactly. If I can have one more question, kind of follow-up question, and it's interesting because it's also written very well in Lise's book. It's a question about cats. Can you titer test cats?
Yes, you can titer test cats against panleukopenia. That's actually the titer test for cats tests panleukopenia and flu. But all experts I've ever heard say that the flu part is not, it's just not a good way to test immunity against cat flu. So what I recommend, based on what the WSAVA guidelines say, is that panleukopenia, just like the dog core vaccines, provides lifelong immunity, and you can confirm that through titer testing. Whereas flu should be, whether or not to give cat flu vaccines should be decided based on an assessment of the cat's lifestyle. So if you have an indoor cat that doesn't go outside, just don't bother. If you have a cat that goes out, stays in the garden, sits on the patio, the guidelines are saying you may want to do it every 3 years. But if you have a cat that goes into back alleys and fights with snotty stray cats or whatever, you might want to do it every year. But that you should do it based on a risk assessment of that cat's lifestyle rather than on the basis of a titer test. But panleukopenia you can test against. Yes.
I mean, two things I would say. One is that the big one that I think is a high risk for cat flu is going into a cattery.
Yeah.
And if your cat never goes into a cattery and you don't live in like a super high density cat population place, your cat's probably not going to be high risk. And if they do get it, it's probably going to be quite mild. I find most of the bad flu cases are ones that had it as a kitten or that came from a rescue place where they had it at the rescue centre and they end up with some kind of chronic viral issue going on. But the majority of cats, like neither of my two cats have been vaccinated since I first got them. They're rescue cats. And they've never had flu. We don't live in a high cat population place. They don't go to a cattery. But I think the other thing is that obviously it's much easier to take blood from a dog than from a cat. A dog is much more likely to let you just take some blood from its leg, go on with its day. Cat blood taking can be more tricky, and obviously for a lot of people it's harder to get their cat to the vet, so it's just an extra thing that a lot of people just opt not to do. And I remember when I worked at Mark Elliott's practice in Chichester, we used to have the cat teeth testing kits in, but we ended up stopping stocking them because we would never get through the whole kit before it went out of date because there just wasn't enough demand for it. So in most cases I think vets would send cat teeth tests off to a lab of some kind because it's just not generally worth keeping the kits in, so it's not generally available so cheaply.
But it's, I also find that if you have a cat with, you know, if you have a healthy cat with a reasonably low risk lifestyle, there's something slightly bizarre about, I mean, the highest risk to that cat is going to be going to the vet. Whether it goes for a vaccine or a titer test, that's going to be the place where it's going to be the most exposed. So probably healthier in most situations just to stay away
Stay
from
away
the
from
vets. Just a thought. We are actually we're out of time. That was
that was a great way to end, with stay away from the
oops. Please don't quote me just by
take out of context. Lise,
yeah, exactly. It's very easy to get misquoted. But yeah, absolutely. We have to stop. Thank you so much, Vicky. It's always so nice when you're here.
Always a pleasure.
Come back very soon. We in fact we have you on the diary in the calendar to come back very soon.
March, yeah.
Yeah. Looking forward to it. Okay, I'm going to see if I can end this.